Hello and welcome to another episode in my new video studio. Yeah, I have already talked about that to have another interesting guest here. It's Tim Zoltie from England, who's teaching clinical photography, dental photography, medical photography, a lot of different things. We met before and during the pandemic. I remember that we even I was invited by you as a co-author of an interesting article related to the disinfection protocols, something that during the pandemic was everybody was asking, how can I shoot images during the pandemic? What can I do with my camera? Because cameras, like all our standard cameras are not made for being disinfected. You can clean them on the surface, but they are not, you cannot put them in a sterilizer or do anything else. So maybe this is also a topic that we can talk about later. But today I want to introduce you to the community because we have a lot of common projects coming up. We will meet at the IDS in Cologne, but maybe we can talk also about that. So Tim, let you introduce yourself to our watchers, listeners out there, who you are, what you're doing, and why it's important to have people like you at the universities.
Yeah, hi. Well, thanks for inviting me on. I'm really pleased to be here and talking about what I do. Essentially, my role is as a medical photographer. So I'm a specialist medical and dental photographer. I'm not a clinician. So I started in photography at university. So I did a Bachelor of Arts in photography and design. And then, like most people who do my profession in photography, they come out and they think, all right, I'm going to be a fashion photographer. I'm going to be a commercial photographer. I'm going to go into the worldwide industry and it's all going to be great. And soon you realize that that's not always possible. And
Just
you,
just to interrupt you, what was your first education? So you studied photography, general photography?
yeah, so general photography, so a full 3-year BA degree in photography and design initially. And then when I got a trainee post as a medical photographer in a hospital, which I'll go into in a second, I then further completed a postgraduate cert, so a PG cert in clinical photography, which was a 1-year specialist course learning all elements of clinical photography from ophthalmic imaging, retinal screening, dental photography, surgical photography, and the main elements of legal and ethical, so consent, governance, that kind of thing. So I did medical for about 11 years, 12 years, and then I moved into dental photography about 6 or 7 years ago. So I've been almost doing it about 20 years now, and now I am head of medical and dental illustration at the University of Leeds. So I work in a specialist unit, or we're a clinical photography unit of 5 staff. We photograph around 8,000 patients per year, and we do mostly pre and post-operative student patients, and we also do oral medicine, restorative orthodontics, and that makes up the bulk of what we do. Other than that, we are also a media unit, so we do print services, design, illustration. It's a multi-skilled team. We're like a media unit within the hospital, if that makes sense.
Cool. So are you also teaching the dentists, the doctors at the school?
Yeah, so at the moment, we're going through a process called Curriculum Redefined, which is reevaluating the clinical curriculum to see where things fit in. As you well know, photography is an important element, but when you look at dental school curriculum, it's not currently taught in there. I'm on a mission to get it put in because we know how valuable it is and it's being used more and more. I'm sure you probably know the stats of how many people are now undertaking photography. I think the last national survey was around 12 years ago and it was about 40-50%. And I can only think that that would have at least doubled in 2025. So it's an important element that's being undertaken, but it's not really being taught. We do local teaching, so we do train our undergrad students here at the University of Leeds, but at the moment it's not built into any curriculum within the UK.
As important as to teach dental students how to take an X-ray, because it's an important part of our of our treatment planning, the diagnostic process, X-rays, photos, scanning, all this is for me, a crucial and essential part of our profession. And it's interesting that most dental schools don't have the time, don't find the time to do that. I remember also when I was a student, there was like one camera. The assistant of the professor had a camera to document cases for the professor. And sometimes he entered also the student clinic, walking around, looking for nice cases, shooting images. And it was like, ooh, now somebody's coming with this magic thing called camera and is shooting pictures. When I was a student, it was still analog. So this was a little bit more complicated than today. But even today, when I talk to the students, most of them, if 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 you find interested students, they start off taking their smartphones to shoot images because they don't have a camera, because they don't have anything else. So I tell them, better than nothing is using your smartphone, but it would be better to step into that photography and learn more. But I think we should push it even more to bring this important part of education, which doesn't really take long. If we're honest, it's not. You don't need a year to learn to take a picture. The
Mm,
basics you can teach them in an afternoon or in one day, and then it's about practice, practice, practice. The same as we did with the X-ray course was like 2 hours, and then
mm,
they told us, look, now you know how to shoot an X-ray, go out and do it, because depending on the patient, of the anatomy of the patient, it's not so easy to take an X-ray. The same applies to photography. Not all the patients have this huge mouth where you can put the biggest mirror inside and get crazy shots. Sometimes it's tiny people with small mouths, and getting it more complicated to do photography. So basically, you are starting this initiative in the UK to get out to the dental school. So what
yeah.
are you doing, or what are your plans on that?
So at the moment, as I mentioned, the curriculum
Or
defined is one of the key elements for that. It is hard because when you look at the curriculum, it's compacted already. Every dental student that comes out of dental school will probably turn around and say, "Yeah, it was a lot," you know. So to add an extra element in, I think my argument is there's three main things that you want to be training students in dental photography, and one of them is going to be the equipment because no one's used to holding a camera. It's a whole foreign thing for you. So I think a lot of dentists are put off taking photography because they don't know how to use the actual machine. That's one element of the training. Second is obviously the technique. So once you've got the machine working and it's perfectly fine, if I came in and set your camera up, great, but there's still then that technique. A lot of that will come with practice. And then thirdly, you've got the legal and ethical elements. And to me, that being the most important. If someone's doing pictures and they're not that great, the quality isn't great, then that's okay. I'll accept that as long as they're doing it right in terms of legal and ethical. And not only in the UK have you got to worry about GDC, you know, people think I might get struck off by the GDC. One of the key things you need to look at is the ASA, the Advertising Standards Agency, because they're clamping down a lot on plastic surgery. Plastic surgeons are advertising before and after pictures that aren't always accurate or that might be slightly misleading. And it's only a matter of time, I think, before the same standards agency look at cosmetic dentistry and say, hold on, your before and afters aren't representing the true treatment that's been undertaken. So some of the training I want to instill in students is to ensure they're undertaking it following legal and ethical guidelines. You know, make sure they're getting the correct consent, make sure they're not posting images that are misleading. And then the secondary elements would be on equipment and then technique after that.
and a lot of things that we see might not be real. So for example, I dared to post a comment on a clinical picture of a dentist, of a so-called famous dentist, and asking him, but this picture is too good to be true. Maybe there was a little bit of Photoshop involved in this. And the
I bet
answer
that didn't
was,
go.
he blocked my account. And blocking my account was the yes to my question. It was Photoshop. And it's sometimes hard to believe what you see. We have this trend also of over soft boxing and flashing away everything. I always tell people, you don't need Photoshop. If you know how to work with the light, you can hide everything, you can show everything. You can show the details, you can hide the details. And these are also important things, especially if we talk about legal and ethical parts.
When you look at people's online, sometimes when you look on social, I can kind of tell as a photographer, I can tell whether they're doing it because they're intending to mislead or whether they're just generally not good at photography. It's normally like you can tell, you look at the images, the post-op is always cooler than the pre-op, which is always warmer, so it's meant to look nice. There's always lip gloss on the post-op picture. I can tell these kind of ones that are done to deceive the viewer versus someone who's just getting it wrong each time. But I don't think the general public would have that same level of detail to understand that.
And how we as dental professionals or photographers like you see things, there's a huge difference between the two sides. And sometimes I have to say we might be overrating our impact on our patients when showing this fancy things, because it's a very personal treatment, personal style. For advertisement, you might use that. The nice girls, the nice boys, all the time, the patients are around 20 years old, look great, have nice bright teeth. And it's interesting that the younger generation then jumps on that, says, Alessandro or Tim, can you teach me how to take these pictures? And they say, yeah, you can go on the street and look for nice looking young boys and girls that never had dentistry, and take the pictures and tell people, wow, this is my patient after getting 10 veneers or after having a bleaching in my dental office. So for advertising, we can use photography for sure. But what is your vision or your idea about marketing use of dental photography? I don't know. What are the rules in the UK? Let's say in the European Union or in most countries, you're not allowed to present misleading information. Basically, you are not even allowed to show before and after in some countries. So it's really a thin line what legally is accepted. So how are the rules in the UK regarding marketing using pictures of patients?
I mean, it's pretty much the same. It can't be misleading. It can't exaggerate the treatment, or it can't show a totally different treatment that's undertaken. And also, it's the omission of information can also be taken as misleading. So, if you fail to say something, it's not like you're saying, "Look, I did this," and you didn't really do that. That's an obvious like case. I did this treatment, and you didn't really do that treatment. But what's not obvious is an omission of that information, and that could be in the picture itself, or it could be in the text underneath. So there are several ways you can fall foul of ASA. I recommend reading an article by Jolene, and I'm sure we can share someone when we publish this, some links to those. But there was one in the Plastic Surgery, a law magazine it was in, on the rising cases of before and after plastic surgery. And it was a patient who went to a surgeon, a well-known surgeon in the US, who had, over 1 million followers, of which she was unhappy with the surgery she received. And they investigated and they found, yeah, some of them were misleading in pre and post-op pictures, or led you to believe that that was a surgery that you could get. So I think it's just a matter of knowing yourself what treatment you've undertaken and ensuring that you're portraying it in the best light. And that's the same with, like, you could have that argument with diffusion. Is diffusion covering up things? Is it omitting the fact that it's not actually perfect and it's making it look more perfect than it actually was? Or am I accurately representing what it looks like in real life?
And the other thing is, I posted it several times, and I shared also the patient consent forms. So a
Mm.
lot of a lot of dentists and doctors are posting images of their patients without asking them. So basically, this is a nice case. I will post it, and it's interesting. And I know some colleagues who never share pictures of patients because they say, I find my cases somewhere on a website or even in a presentation of somebody, just using my images to show before and after nice cases. So this was an ongoing thing also. But patient consent for me is very important. And a lot of people, I think, are underrating these points as well. So asking your patient is one thing, but getting consent. But even then, it's interesting. Even if your patient signs something, at any given point, he can say, I how do you say in English?
Track.
I retract my initial consent,
Mm,
delete all your images that you have taken, and this can happen. It's not very often, but you have to be aware of that. You can present a nice lecture with a case showcasing a beautiful lady or a beautiful young boy. The majority still are young ladies because the majority of presenters still are men. This is changing, and I'm always wondering if the profession does the switch that we have 80% women, will they show more men in their presentations, or will they still keep showing nice girls? So if you look at the percentage, how many patients that you see in lectures are female patients and how many are male patients that are presented to the audience? Majority is female. It's interesting. So
mm,
these are this is other stuff that is maybe cultural. I don't know, but the patient consent is
possibly.
something that is really important to
Yeah.
highlight, that we need to get the authorization to use our images.
And consent, some people think that consent is just for the use, but it should also be for the process. Consent is about asking them to do something. It's not necessarily a treatment photography, but it's quite invasive. You're putting mirrors in the mouth, you're putting retractors in, you're using flash. A lot of people just say, "Can I take your picture so I can use it on this, this, and this?" When really you should be saying, "Right, are you happy for me to take your photograph using this? It's going to be quite invasive. There'll be a bit of flash. It's not going to hurt, but it's going to be uncomfortable." And then they say, yes, you've got the verbal consent. You've got implied consent because they're going to hold the retractors. And then you want the written consent afterwards for saying, I want to use it for this, this, and this. And I think what some people do is they get blanket consent, which for us, for GDPR, certainly in Europe, it has to be specific in nature. You can't just say, I'm going to use it for publication. You should really specify. That doesn't necessarily mean you have to write on there, I'm going to use it for a 20-second TikTok video and then I'm going to use it for one single post on Instagram. It doesn't have to be that specific. You can just put social media, but you can't just tick publication. Really, you should put medical journal or social media just so they're aware. Because they may think you're going to use it in a medical journal when in reality you're going to publish it on Instagram to 100,000 followers. So it's just making sure that they're fully aware and they're fully informed before making that consent.
Absolutely. Let's switch topic and talk about mirrorless cameras.
Mm.
Although they are around for many years, I remember Sony was mirrorless many years before the rest. Canon and Nikon struggled. They struggled because I think they did not realize the potential of switching from DSLR to mirrorless. And I remember 2016, Nikon entered the mirrorless market, and soon after also Canon, or both more or less at the same time, but keeping the DSLRs. And then now 2 years ago, finally they stopped producing DSLRs, discontinued any development, and are focusing also fully on mirrorless cameras. And my question is, you have also the experience. We both are now using Sony cameras mainly for our photography, but it's an interesting discussion. If we start looking at the dental photography market is still 45% Canon, 40% Nikon, and then it's all the rest. And if somebody's asking me, there are, let's say, two reasons. Reason one is, for example, in South America, you have way more Canon users than Nikon users. So I think there's 70% Canon and 20% Nikon or whatever. And these different numbers are related to the service provided in these countries. It's interesting. For example, Switzerland was a Nikon country when it started with DSLR, way more Nikon than Canon, because Nikon had much better professional service compared to Canon in relation to the dental community. So they were more open. maybe because I was also really pushing that. And in other countries, for example, in Germany, you have a majority of Canon users because Canon offered a better service. So I think the service is also an important thing to connect with your clients, with your customers, with your users. And now let's talk about the switch to Sony. Canon and Nikon, they had a macro lens, a macro flash. And that's why if somebody was asking, I want to do dental photography, which basically is macro photography, what can I buy? And then any photo dealer would have told you, okay, go for Nikon and Canon because I have a Canon camera, I have a Canon macro, I have a Canon ring or lateral flash. Here you go, take it, use it. And the same for Nikon. And when you were interested in doing the same with Sony, it was, okay, we have a Sony camera, we have a Sony macro, but we don't have a Sony macro flash. So this was for me, I was always wondering why Sony waited so long to really jump into this. And we had, or I was lucky. You also know that Sony started the collaboration with Godox, and this is interesting that it took so long. Maybe they had to jump over. In German, we say you have to jump over your shadow. You know,
Okay.
over your shadow is when you do something that you are not really comfortable with, you don't really want to, but okay, I do it now and to enter something new. So
But
basically
Nikon never had a ring flash though, did they?
they
I
have,
mean,
yeah, yeah, they had one
they
of the
had the
best.
twin.
No. Originally they had both. They had the R200, this small lateral flashes, and
Mm.
they had the SB29. It started with SB21 and ended up with the SB29S, which was one of the best ring flashes on the market, and it was discontinued for I don't know what reason. They discontinued this flash many years ago already,
I
and
think the
then people
Sigma.
started jumping on Nissin flashes, Sigma flashes, you name them, Yongo, or how do you spell, or all these brands jumped in because they realized that Nikon was just no longer producing their ring flash, and that's interesting. And now I think Godox made a big move with the ring flash and the lateral flash system. And you know why? If you look at the numbers, this macro flash system, dentists are not the number one buyers of these flashes. The macro photography community is so big
Mm.
worldwide, taking pictures of coins, of insects, of flowers, of everything. So basically, more people are shooting or using these cameras for non-dental purposes. But what is your? I think, did you start with Canon, Nikon, and switch to Sony, or what was your story in this regard?
Personally, I was Canon, so I always shot Canon. Departments, so most medical illustration departments across the country, certainly in the UK, there's probably about 1,000 medical photographers in the UK. I'd say predominantly shoot Nikon, mainly based on historically Nikon had the F1, everyone had the film cameras for Nikon. So when it converted to digital SLR, they just naturally moved across. So in my office, in my studio, we were all Nikon. My personal camera was Canon. And then I bought the first A7. I'd hardly used it because you're just used to what you're used to and you don't want to take it out the bag. Especially when I'm going on a paid commission, it was a lot for me to go, right, I'm going to learn this new camera. You know, you have to kind of drop your SLR and just start using mirrorless. So then I moved to Sony and then obviously still Nikon in the department, which is slowly changing. So we're moving across to Sony now for clinical. But yeah, like you said, without a ring flash, it becomes difficult. And I can understand why they're not manufacturing them or why Sony don't manufacture them because we think of the industry as being huge. We think of the dental industry as being huge. In the UK, there's about 110,000 dental practitioners, not dentists, just dental practitioners, 110,000. And market-wise, that's tiny compared to the consumer market, the mobile phone market, the TV market, you know, all of those other markets that Sony can go into. So I can understand why it was so slow to get off the bat. But now with that Godox ring flash. It was just the one key bit missing from that kit to make it incredible. And now they've got that, it's like just straight away the best kit, hands down, for this kind of thing.
No,
What do you
because the advantage for me, I'm sure I have all the cameras here because I want to compare. But honestly, I'm getting used to Sony more and more. Although Nikon is also a very nice camera, and I see that Nikon also the latest models of Nikon are still great cameras. They have video capabilities that are even as good or maybe very close to what Sony offers in Sony in camera in video capabilities. But Nikon still has the highest resolution in the viewfinder, the highest resolution in the LCD screen in the back. So they take care of details that make their cameras also more expensive because the build quality is different of certain parts. And the main focus is still so that the soul of Nikon is still more on photography than videography. And I think Sony is a little bit more open to different fields. And honestly, I was happy that they are now also entering the dental photography market because when I started shooting videos, I started using my Nikon cameras, but I always struggled a little bit with the colors and some things, and found Sony way more straightforward when producing video content compared to other cameras. Maybe some Nikon or Canon professionals would say, but we can, yes, sure. You can shoot great videos with Canon, you can shoot great videos with Nikon, but I'm talking about people like me or other dental professionals who are not photo professionals, and we want easy solutions. So we want something that we can set up very quickly, very easily, and use it for photography and videography. And I see that a lot of colleagues are asking me, what camera or why are you now shooting more with your Sony camera? And say, yes, because beside photography, video content creation will become more important also for your daily workflow, for your daily documentation. And then Sony is, from my point of view, easier to shoot great videos out of the camera. So what are your thoughts on this argument? Why switching from
I
Nikon,
mean,
Canon to Sony, or what made you switch
I
from
think as
Nikon to
a
Sony?
and photography and cinematography, the first reason related to that is just the breadth of lenses, the breadth of camera bodies that are available. So I'll use an FX6 for filming, I'll use an FX3 when I need to be run and gun and moving around. I'll use an A7 IV if I need to use it for teaching or webcams, for example. I'll use an R5 if I want full resolution. There's so much breadth in the system, and I can shoot film and photography in one. Now that I might appeal to some dental practitioners, definitely, including yourself, the ability to move from between those formats so easily. The second part is just simplicity. And when I'm teaching and I'm teaching other dental practitioners to use camera kits, I want a kit for them to be able to pick up and use quite easily. Now, there's twin flash systems, there's multiple resolution cameras, there's all sorts of like things that make it easier to use. Focus distance scales on the lens barrel, which the Sony has and the Nikons don't, or it's only on a screen and you have to pick between them. Um, Focus peaking, all of these small things that make it a lot easier to use are the things that I valued the most, because then when I'm training, it's easier for me to teach them. Like ETTL on the flash is incredible. Like it's so accurate on that Godox, the MFR 76S Plus. It's so accurate that I can tell them to choose camera settings, leave it at that, and they can shoot the whole series without touching the camera. Now, for a non-photographer who's taking pictures, that's a godsend because they can then just do the whole thing without touching the camera. They don't have to worry about that camera system, that equipment. They can just get to learning the technique and not have to worry about exposure. So things like that, I think, make a difference.
So basically, when we developed or developed further the Godox MFR 76, so the TTL version, there was like the manual flash already around for 2 or 3 years, and then and in the Sony collaboration with Godox, we did this S Plus, so the dental mode, And it's interesting. It's interesting. We really tweaked around and tested different scenarios. And if people ask me, it's like it's a manual flash on steroids. So basically, because the condition of the mouth are, yeah, there's no huge difference. It's not that you have sunlight dark. So basically, the mouth is dark. If you focus on the front teeth, it's a little bit brighter, but basically the conditions are more or less the same. And I remember an interesting thing. Nikon refused for many years to have TTL in their macro flash systems because they told me, and I talked to engineers in Japan, TTL at this close distance doesn't work reliable. It's not reliable. So you can get mismeasurements in especially when pointing to the mouth, that you can overexpose, underexpose, and get frustrated. That's why they refused TTL for many years. They did it, and honestly, the first TTL on Nikon ring and lateral flashes was like a manual, a corrected manual mode. So basically, it was like an average in this. If you shoot 20, 30 centimeters, you need 1/8 power or 1/16, and the TTL was working from that point and adjusted a little bit to avoid extreme over and underexposure. And the same is also with the Godox. So we are working from like an average situation and then do a little bit, but you get almost much less dropouts in the sense of overexposed or underexposed images than we used to have some years ago with Nikon, Canon, or many other flash systems where the TTL was not working. So I think also the cameras are now better measuring the light situation, analyzing the situation. So what are you as a professional? So do you agree that also the evolution of the camera, of the measuring systems improved the TTL capabilities in dental photography?
Yeah, I think so. And the metering is certainly better. I mean, obviously you can set evaluative metering, spot metering, there's all these elements where you can set the camera to evaluate the scene in different ways to get that exposure setting. But as a dentist or a dental practitioner, I'm more than confident in thinking that you don't want to be doing that midway through. You just want something that can look at the scene itself, analyze, and take that measurement and expose it correctly. I would say we're more scientific in terms of our approach to dental and medical photography. So we would have manual flash power to make sure that we're perfectly accurate. But a lot of the time, that perfectness in exposure doesn't outweigh the complexity of shooting in manual mode. It's better to shoot in ETTL, automatic exposure, just so that, you can decrease the time it takes you to take photographs and you can get it almost close to spot on, especially if you're not measuring exposure changes over time. If you're changing, if you're looking at something that's getting brighter and darker and you want to monitor those changes, then 100% you would shoot in manual flash. But most of the time, you're just looking at a shape change or, some change that you made in there that's not exposure based. So I wouldn't worry about setting it on automatic. And because it's more accurate now, like I do recommend a lot of people do that.
Absolutely. So our next meeting will be in a month at the IDS, the dental show. I'm really happy that Sony made it, that we will have a small booth, and I know that you will be there, others will be there, I will be there, and we will be teaching dental photography for
Yeah.
sure. And if anyone is joining or coming to Cologne, feel free. I don't know the booth number or where we are exactly, but we will share this information because I think Sony UK is like leading the thing, and Michael from Sony Europe is helping a little bit on organizing all the stuff. So as soon as we have more information, we will certainly share that on social media and all channels. And hopefully we will see and meet many of you there. What I want to do is, I told Michael what we have to do: walk around the IDS, the dental show, and ask ask the dentists what camera they're using, if they're using a camera. So maybe it's like a small survey we are doing. because today the majority of dentists are shooting still with smartphones. And this was this week, from 2010 to 2023, there was a drop of 94% in sales of digital cameras. So in
Wow.
2010, it was $121 million in sales, and it dropped down to 8 or 9 million. Really dramatic, a dramatic drop. So that the market of our digital of all these cameras is really small market compared to the smartphone market.
Well, the
But
compact, is pretty much fully dissolved. You know, there's just no.
the compact market is almost zero. The
Yeah.
compact cameras have been replaced 99% by smartphones, and that's obvious. I would say you don't need that. And now we have more specialized cameras for video shooting, for photography, and I think this niche will not die. Maybe even grow a little bit when more people want to create high quality content. Because honestly, the sensors and the lenses in a smartphone, it's physics. They cannot be as good as huge as a big lens. That's not possible. So this is physics, and with all the artificial intelligence and all the tools, well, yeah, but
I
yeah.
think we should show that at IDF. We should do a workshop. In fact, yeah, we'll do that. We'll do a little video workshop because we'll be doing demos. We'll be doing dental photography demos on the
Yeah,
stand.
yeah.
So anybody who wants to come and have a demo from either of us taking photographs, visit the
No,
stand,
no,
but also
that's the
we'll
goal.
probably do some video.
I talked to Michael that we want to invite as many people involved in the Sony Godox program from different countries to join, to come and see us at the Sony booth and collaborate and help and spread the word. So basically, what we want to do is to motivate people to shoot more images. And because I honestly, we will see that a lot of people, if you ask the young dentists, are you shooting images? Yes, or maybe they even say no. And if they say no, say, why? Come on, why? What
Yeah.
is the problem? Come and see us, and we will show you that it's easy, that it's really easy to take pictures of your clinical cases. You need them for documentation, for self-evaluation, for marketing, for social media, for so many things. And well, I think there's no reason not to shoot images in your dental office or during your dental career. And it's interesting. If you look at young dentists that are really highly motivated, they shoot a lot in the first 5 years and then start shooting less because you don't need really to document every case. That takes time. And if you have documented a composite filling 50 times or 100 times, well, the 101st and 150 and the 200th time, it's the same. It's nothing different. So, and it's interesting that a lot of young dentists are telling me, yeah, I had like a photography burnout after 5 years because I realized that it takes time to really document all the steps of my treatment. And I'm now I'm more selective on what I'm shooting. As you came late to the interview because you had to go for a shooting, for an intervention. So basically, they are not calling you for all procedures they're doing. So they're calling you for procedures that are special, interesting, need documentation. And also in dentistry, it's not that we need to take pictures of everything we do. We don't take X-rays of all the teeth we treat. So basically, it's the same, but you should have a camera ready to shoot in your dental office. Now, I know a lot of dentists, they have the camera and then they say, yeah, I remember I attended your workshop 10 years ago. I still have the same camera. And well, oh, maybe tomorrow I have to look for the camera and use it again. So a lot of people have cameras and they are just somewhere in a drawer. And
Push them off
even,
taking
and
it out again, isn't it? Because they're
yes,
just a
no,
bit
the
like,
thing at the
yeah.
IDS, I think at the IDS, we need to create more awareness that photography is also fun. It can also be a little something that makes you work. more fun. And my patients, they like if I take pictures. It's not they say, wow, what is this? So if you involve them and show them also some things, so you shoot the picture, and on the small screen of the camera, you can show immediately the result. Look how this filling, you don't see the filling on the picture. So all this stuff. And I'm really looking forward meeting you in Cologne next month, and many of you out there as well. We will share more information on where we can meet. And for sure, we need to meet also the dental TV community, the dentist.camera community. So my followers, I will also invite all my followers to join us at the IDS in Cologne and talk about dental photography and much more. So we will do some field interviews with random people, talk about their struggles, what questions they have. Maybe they have even questions we don't even think about. And this is interesting to go into the crowd and ask, what are you struggling with? How can we help you? How can we motivate you to become a passionate dental photographer as we are, as you are, Tim? And yeah, that's it for today. And yeah, see you soon. Talk to you
Thank you.
soon. We will do dental photography frequently asked questions series with Tim for Dental TV, and not only for Dental TV. I have all the questions ready, Tim. You need to save some time, and then we will
I've
go.
probably answered many of them before. A lot of
Yeah,
people ask similar questions
basically
to
it's a
me.
collection. Basically, at the end, it's a summary. It's a summary, but a structured summary. I think we should record of the steps of the starting with the most asked question, and then
Definitely.
go down and answer the question, debunk some myths that are around dental photography, some wrong information, and so on and so on. So I think there's a lot to teach. And Tim, you're the man.
Thank you.
Okay,
Yeah,
so
that'd be
this is
fun.
for today. Stay tuned for Dental TV, LinkedIn, social media, IDS, Sony, wherever you find us, GoDocs, and so on. That's it for today. Thank you, Tim, for taking your time, and happy smiles, happy shooting, and may the light be with you.